Before I get to the important announcements, I'll just give you an update on where we are with COVID-19 restrictions and the interstate border. Firstly, I can confirm Western Australia had no new cases of COVID-19. That's no local cases and no cases from overseas. So that is good news. And yesterday we recorded a total of 3,194 tests across Western Australia, which is a good outcome as well. Since Sunday the 31st of January, the day we went into our snap 5-day lockdown, we've conducted nearly 95,000 tests across Western Australia. 95,000 people have been tested. This is an amazing result, and I'd like to thank everyone who got tested over this period. The Chief Health Officer has advised that the full 14-day incubation period is on track to run its course with no indication of any community transmission. West Australians have been fantastic throughout this difficult period, and it's the sacrifices they have made which has meant we can return to our unique way of life here in WA. The past 2 weeks has challenged us all. The snap 5-day lockdown and our transitional restrictions this week, including mandatory wearing of masks. Thank you to everyone. An incredible achievement to prevent any community transmission of the virus. We have now gone 10 months now without community transmission of the virus. What it did show the last 2 weeks is that our systems have worked. Our ability to manage restrictions, our contact tracing systems, our health and testing systems, our police, checkpoints have all stood up to the task. These were things that had been criticised from the east, that Western Australia wouldn't be able to manage these things, and the last 2 weeks have shown that we have been able to put the systems in place, and they have worked very, very well. And now we can get back to where we were. Based on the latest health advice from midnight on Saturday night, the transitional restrictions will come to an end and we will revert back to where we were on the 30th of January. Only a few restrictions will apply. The standard capacity rules, restrictions on remote Aboriginal communities, mandatory contact registration, and of course our controlled interstate border, which is unique amongst the states. The wearing of masks will no longer be compulsory as of Sunday morning. I know it's been annoying, but the response from everyone has overwhelmingly been terrific, and I'd like to thank everyone for that. But please keep up your COVID-safe practices. Wash your hands, keep a distance where it's possible, get tested where unwell, and keep using Safe WA. I want to give a special acknowledgement to our dedicated health staff and the West Australian Police. Our teams at Health geared up and dealt with a significant increase in testing, long hours, extra clinics. They all did a great job. And to our police, who did a brilliant job across the community, ensuring people were following the restrictions and providing an important community service, I'd like to say thank you. They also did a brilliant job staffing 9 checkpoints across the state as part of the travel restrictions we had in force. Thank you to everyone for what they did for our state during this difficult time. People have been fantastic. We also have some very important updates to our border controls. Firstly, to New South Wales. This morning, an emergency meeting was held in relation to a range of COVID-19 matters. The Chief Health Officer provided updated advice on the situation in New South Wales, and with the last community case of COVID-19 recorded on January 15, New South Wales is due to reach 28 days of no community transmission today. As a result, we can safely move New South Wales from low risk to very low risk. A decision was taken for this to occur from 12:01 on Tuesday, February 16, that is Tuesday morning, pending no further outbreaks. Just to be clear, under the very low risk category, safe travel is permitted into WA subject to the following updated conditions. Completion of a G2G pass declaration stipulating the person does not have COVID-19 symptoms and which jurisdictions the traveller has been in over the previous 14 days. All Perth airport arrivals from New South Wales to undergo a health screening and temperature test. Travellers to be prepared to take a COVID-19 test at the airport COVID clinic if deemed necessary by a health clinician, and land arrivals to be met at the border checkpoint for a health screening and to have their G2G pass declaration checked. That applies to New South Wales as of Tuesday morning at midnight, 12:01 Tuesday morning. This will mean all Australian jurisdictions will be classified in the very low risk category except for Victoria. I'd like to thank everyone for their patience and understanding. Now on to Victoria. I know Premier Dan Andrews has just held a press conference. The situation in Victoria is again very concerning. And I want to say that I fully support the measures being taken by Victoria to try and clamp down on these local cases of the virus. As we know in WA, it is just so important to reduce the risk and prevent community transmission. Currently under our border controls, arrivals from Victoria are required to return a negative COVID test result and complete 14 days of self-quarantine. This border control puts us in a very strong position to be able to handle any outbreak in Victoria, if that was to eventuate. However, given the concerning ongoing situation in Victoria, the Chief Health Officer has recommended Victoria be reclassified as medium risk for a short period until the situation is controlled. There will now be a 72-hour hard border with Victoria put in place today at 6 p.m. this evening. Therefore, Victorian arrivals at Perth Airport today will be tested at the airport before going into their 14 days of self-quarantine. Then beginning tonight from 6 p.m, the full medium risk category will come into force until at least 12:01 a.m. next Tuesday, February 16, pending updated health advice. The 72-hour hard border with Victoria means only exempt travellers are permitted into WA. This is the standard exemption list, as we have used before. The exemption list is limited to certain senior government officials, certain active military personnel, a member of the Commonwealth Parliament, a person carrying out functions under a law of the Commonwealth, a person responsible for transport, freight or logistics, and anyone who's given by the State Emergency Coordinator or an authorised officer, particularly on compassionate grounds. The final category, as I said, includes compassionate reasons, including those West Australians that may have travelled to Victoria recently and need to return to WA urgently. These people will be assessed by WA Police and will be required to complete 14 days of self-quarantine and be tested for COVID-19 on arrival and on day 11. Information will be available on the wa.gov.au website as soon as possible.